Child abuse has been a problem in our communities for many years. There are many factors that play a role in the abuse, such as their environment or spirituality. Um, a study was conducted that showed those who attended religious groups were associated with and used corporal punishment more frequently than those who did not. Corporal punishment is used in most homes in the United States as a form of punishment, but has been proven to cause a list of adverse developmental, behavioral, and health related issues among children. The environment that our children are put in also plays a huge role in sexual abuse or assault. The common misconception about sexual abuse is that most people think that it only occurs to young girls and with a male predator in poor inner cities, according to Murray et al. 2014. The reality is that victims can be male or female, and predators can be also male or female, trusted friends, strangers, and of all cultural backgrounds. Most people will not be able to tell if they are a predator or not until it's too late. Thus, going back to the environment that our children are in, for example, mom has a new boyfriend and they begin to get serious, and he moves in and secretly sneaks into her son's room and does the unthinkable, and mom never knows. They usually threaten the child into not telling and keeping it a secret, or making the child believe that they are being punished for something they did. The Stronger Child Abuse Prevention and Treatment Act was introduced by Mr. Scott of Virginia and was introduced to reauthorize the Child Abuse and Prevention Act. The Secretary shall develop and issue final regulations, establishing uniform standards for the tracking and reporting of child fatalities and near fatalities resulting from maltreatment, and better protect children and improve the child's well-being. The number of false reported cases of child abuse has also contributed to the state's inability to respond effectively to serious cases of child abuse. Both parties support this bill and should to improve the responsiveness to child abuse cases, to better protect our children from these situations, and have fewer mental illnesses among children. As stated before, many cases of child abuse lead to the development of a variety of mental illnesses, such as PTSD, anxiety, suicide, and or self-mutilation. The issue at hand affects my future role as a nurse because, firstly, it's heartbreaking to see an innocent child going through something as troubling as this. Secondly, we as nurses have to show the victims of abuse that they are in a safe environment and be their advocate. For example, if a little girl has been raped and has no family around, it is our responsibility to build a therapeutic relationship with them to get them to open up about the incident and relay it to whom it needs to hear it. Talking to people about such a sensitive subject can be frightening. It is also our job to make sure the child is protected and in a safe environment while in the healthcare facility. Thank you.